I'm Dr. Desi. Public health is about social justice. And that is one of the reasons why I'm involved with AIME in order to prevent deadly outbreaks. Dengue is a major threat to mankind. Approximately 2.5 billion people are at risk of dengue, and approximately 440 million cases are reported annually. And bear in mind that it costs approximately $400 million per annum per country to tackle this problem. Public health in general has been working towards a reactive approach. And in AIME, in Artificial Intelligence in Medical Epidemiology, we are trying to shift this direction or this perception of being reactive towards being more proactive. And that is the reason why we realize that we need to incorporate artificial intelligence to tackle dengue. For instance, look at this breeding site. Environment plays a major role in identifying dengue hotspots. That is one of the reasons why in AIME we believe that utilizing environment factors and even dengue cases in a specific location will allow us to predict dengue 3 months in advance in order to stop this menace.
Hello everyone, my name is Rainier. What I would like to show you now is one of the technologies that we have developed in AIME. So right now what you're looking at is what we call the AIME console, which is a tool that we have designed specifically for public health physicians in order for them to analyze and to actually take informed decisions on what needs to be done based on data analysis and data predictions. So right now we're looking at or seeing at the country of Malaysia for dengue case data from June 7, 2016 to June 28, 2016. So the first thing that I can see in the map is these blue bubbles here, which we have labeled as dengue cases. So every one of these bubbles is actually one person that got infected with the dengue virus. So if I, for example, as a public health official, would like to know which are the areas that have the most burden of disease, I can see it very quickly in this table, which is organized by burden. You can see that we have 38 outbreaks and 60 cases only in Pattaya. But actually, let's say I want to go and see what is happening there. So I can click on that button there, and I can see what is happening in the area. Maybe I would like to know how the disease is spread, so I can pretty much just click play and see how the cases happened and how these red bubbles here, which are outbreaks, happened as well. These blinking ones are actually predictions that we have developed with our AI model, which we have spent more than 2 years for the research of it and analyzed more than 276 variables for each case. In dengue control, for example, it is very important to know, not only for dengue, but for other diseases that are transmitted by mosquitoes, Zika, chikungunya, and others, the environment around the areas that are affected. So for example, I can see the wind direction, which I now can say that is west, which is very important when fumigating. So I can know where to fumigate, or towards what direction to fumigate to. I can see the rainfall, which is very important because if I have big rainfall magnitude, that means there will likely be ponds of water around, which should translate in the increased number of dengue cases. And for example, I can also see landmarks that are affected. So for example, I can see that in this predicted outbreak, a church or a place of prayer, a park, and a parking lot are actually key players in the spread of the disease. So these are important points that I can focus my communication on. Other things that you can see are the epidemics, which are a key utensil used by public health officials to analyze the disease, which is calculated automatically for any area that we desire to see, and also other statistics like age, gender or sex groups, ancestry distribution, race, symptoms, wind direction, rainfall, and even the affected landmarks. So the idea with this platform is to actually provide public health officials with up-to-date real-time analysis of the disease. We are actually now implemented into states of Malaysia, and we have also done research in Rio de Janeiro, in the Philippines, and also soon, most likely, we'll be doing as well in the United States of America for Florida. We were inspired to this because right now the public health environment, the public health scenario is not enough. We need to innovate and change the way we work to actually make an impact in society. So for the design of this platform, we were inspired by the stock markets and how quickly it changed. We wanted to simulate something that could provide easy to use information, kind of like the Bloomberg terminal, but aimed specifically to public health and to vector-borne diseases for the beginning. In the future, we plan to add other diseases such as malaria, HIV, even diabetes or tuberculosis.